Want to talk a little bit about your online presence, Stable Knees. Um, Really, it is just so refreshing and different. Like everything I see online with all the YouTube videos that you put up, all the posts on Instagram, all your presence on social media, it's such a refreshing way of like just spreading the word and like helping people. Because I feel like and I've heard you say this before too, and I see a lot of people do this. We've tried in the past, we'll make this content and we'll put it out there about, like, for example, when COVID started, I put out like a bit of content on what are some of the desk stretches that you want to do if you're working from home. But I always thought when I looked at them too, I was like, oh, I'm a physio, so I kind of like to see these things. Like, how much are like my patients going to watch it?
Yes.
And that is definitely a problem. But I feel like you found that particular way where you have that personality and like the way you present it, like it's almost like watching like a your favorite show on Netflix or something, but it does it does have that educational component where you learn something. So there is such a positive, I guess, influence from like the stuff that you're doing. The question that I wanted to ask you was, why stable knees though? Why not stable shoulders or something else?
It could so it could have been any of those things, but it was stable knees because for a few reasons. So as I said, I've had a number of knee surgeries, and so knees is something that has, in my own personal injury and wellness journey, knees have figured prominently. But also, at the time when I sort of picked that name, I had been largely focused mostly on my sports side of my career, or sports side of my practice, I should say. And I still have that focus, where about 50% of my practice is sports based. But over the years, I've sort of adopted a little bit more of other things because, as I said, I work in a community hospital. So that means I got to do trauma and I got to do joint replacements. So that has kind of softened my focus a little bit on sports. But sports was a big part of what I was doing. And with respect to my sports practice, knees are by far and away the thing that I do most. I would consider, if most surgeons kind of pick a joint, or a combination of joints, and then they focus on those things. I would say I've done it a little bit differently, and that I have tried to niche myself into being an arthroscopist. And so basically that's somebody who puts the camera into joints, and I do stuff minimally invasively. And that's how I do my surgery. And I have developed skill set in shoulder arthroscopy, knee arthroscopy, hip arthroscopy, and ankle arthroscopy, which is a little bit weird because most guys don't do that. But of those four areas, knee is the one that predominates most. And so as a sports guy, a lot of what I do is ACL reconstruction, and I'm trying to recreate stable knee. So I kind of thought, oh yeah, I like that. So stable knees, that sounds good, because my knees are stable now, and that's what I'm trying to recreate for people. So that's what that's what I'll go with.
I see. And a lot of like the stuff that you're putting online, for anybody who's not had a chance, we'll like link up all your social media profile. If you start watching that, you'll be hooked on whatever you like. Anybody who's watching this, you'll be hooked on the content that Dr. Raynor is putting out. But I wanted to ask you, did that come naturally, like the way your presence online, or was there some work that is required for it?
Well, obviously, to build that online presence was there is a lot of work, man. People, as I said at the start, any one of the things that I do is could be a full-time job on its own. So social media, everything that I create for social media, that alone could be a full-time job. But because it is a lot of work, and I was fortunate to have my wife helping me in the background to do a lot of the editing for me and that kind of stuff. But it did take a lot of time, and some of it came naturally. Like I try, people often think when they watch the videos, they go, oh, geez, man, why are you behaving that way? Why are you acting that way? Like you just, you don't have to be that way. But the people who say that don't know me, right? And because anybody who knows me personally, they know that what you see on YouTube or whatever, that's what I am. I am a jackass and I am a clown all the time. Because I just think life is too short to take it too seriously, right? So I want to have fun, and so I am just that way. And as I told you before, as a child, I was very loud and very active all the time. So that hasn't really changed. And when I first was putting out content, so this stuff that I did here wasn't my first foray into social media, because I had mentioned before, my sons were very active, and my one son was a very large and still is a relatively large YouTuber. And so I kind of got to see stuff from them. And some of his followers commented, hey, your parents are sometimes in your videos and they're funny. They should get their own channel. So we did that for a little bit. We had a channel on YouTube, which was called The Rent. And it was fun to do that, but there was not really any, other than entertainment, there wasn't really any value. And we still tried to put, shade stuff towards fitness, but it was all supposed to be lighthearted entertainment, funny, not really fitness information packed. So then, we're already busy. It's a lot of work to do that. And it's not really in keeping with everything else that we're doing. So we just stopped that because we ran out of time to do it. But then I thought to myself, well, I kind of enjoy doing that and I enjoy teaching. Well, let's make something where that's what I'm doing. And I told my son at the time, because he had helped us build our first channel, I said, I don't want you to help us because I don't want little kids. I want to try and gain an adult following. And so we worked on building that ourselves. And so now I'm into my 4th year. And when I first started, I did the stuff, that I thought, I'm trying to teach people. So I'm trying to do didactic type of stuff, just purely educational. And then, when I looked at the response, I was like, people are not, they don't want that, right? They click off of that. And so then I thought to myself, well, how can I make this more engaging? Oh, well, I can take current events, I can use those as topics, do that kind of stuff, and just be entertaining, because I'm just a clown all the time. So just be entertaining. And then when people are laughing and they're not paying attention, I just kind of sprinkle in a little bit of education, right? And so you engage people with the entertainment, and then you teach them when they're not paying attention. And that's my goal always, right? And so, and now that I'm starting to learn a little bit more about the process of content creation, storytelling, and just how YouTube works and how the other social media platforms work, I think, I guess I'm a slow learner because it's taken 4 years, but I'm just starting to figure out how to kind of do stuff that is engaging and that is the kind of stuff that people want, but will also be very educational and provide value. I walk around frequently, okay, I'm not necessarily saying this out loud, but I am saying this in my head when I look at my content or whatever. Value. How can I provide more value for people? How can I provide more value? And I look back at posts and I go, oh, that was a pretty good post. Not enough value. How can I provide more value for people? How can I give them more? Right? That's what I'm always trying to figure out and think through in my head. So, it's very it was challenging to build it up, and it's challenging to be able to figure out how to do all these things. But ultimately, I'm really trying to figure out how I can maximize value for patients, and not necessarily patients, but for viewers, subscribers, people who watch. How can I give them more value?
Yep. No, it's absolutely brilliant. The stuff that's out there, like it's so engaging. You could sit and watch that for hours. Some of my favorites, and there's so many. I was trying to watch as many as I could. I couldn't see all of them. I saw you did one on cricket. I'm not a big cricket fan, but I did see you did one on cricket. I like the one. I like the milk crate challenge. It was hilarious, but there was so much value to it too.
Yes. Well, and again, that's something that is, at the time, that was something that was trending on TikTok. Lots of people are getting injured from that. So, and lots of people were engaging with that content. So I thought I can talk about that, because there's lots of video I can pull to analyze from TikTok or from YouTube. And then I can give my orthopedic spin on it, right? And I can say to people, well, everybody watches it because it's funny, right? Or they're watching because they want to see the injuries. But I can say, okay, well, here's how I see it from an orthopedic perspective, and recognizing that, people are watching it for the humor, but I can say, yeah, there is a humorous side to this, but also there is this medical side. Like, if you get injured, there is a consequence to that. And this was what can happen, and just give people a little of that information, right? So yeah, that particular one was something that was very a timely video when it came out, but it presented a great opportunity for me to be able to give a whole whack ton of knowledge. There was a lot of orthopedic things that I could talk about in that video. And I want to educate people so that not everybody wants to be an orthopedic surgeon or something in MSK. I recognize that too. So I want to give people some education about what could potentially occur, how, if you get injured in this manner, what you can expect, how you're going to be treated, how long are you going to be out for. I want to give them all of that. And I want to give that to people who are in the medical field, but I also want people who are just lay people, just to get a little bit of an understanding, right? So that I want to, like, part of my goal is to educate people about orthopedics and sports medicine and injuries, and just the hard knowledge. But also part of my goal, and this is part of the reason why I don't stop being a jackass, part of my goal is to teach people that medicine surgeons, we're not all in this high silo up here looking down from the mountain, and that you can't talk to us, we're not relatable, none of that. Part of what I do, and I do it purposefully, is to show people that we're approachable. I'm just another guy, man. I'm just like you, right? Just like you. I behave like you and your friends. I just happen to be a surgeon, and I can help you if you break your leg. But I am approachable, and part of the efficacy of treatment, whether it's rehabilitation work or whether it's surgical work, I don't know the actual figure, the amount, but part of the efficacy of treatment stems from the relationship that you have with your healthcare professional. And the more I can make myself down to earth and approachable and just another guy, the more I can do that, the more that I can debase myself, the better for my patient, and the more opportunity for the care that I give them to be effective, right? Yeah. So I don't have a problem with that.
Yeah, and And I've kept you here for a while. So before we move on to our last section of the podcast, I did want to make a comment on this part was before I would always look at these social media platforms as they were being introduced. And I would always think like I'm above these platforms sometimes. Like I took Facebook, but then I would feel like, that Instagram, that's not for me. Then when TikTok came along, I was like, that's dumb. I'm not going to do that. But then really what changed me was when I saw you on there and I was like, here's a surgeon who's doing so many things anyways, and he doesn't feel like that. And he's actually increasing his reach through TikTok. So it really changed my perspective on how I would look at these things now. And now I feel like I'm really open. And I think the biggest takeaway for me is like, I just don't want to say no to anything anymore. Like, unless I feel like there's some value to it, I just don't want to say no to it.
For sure. And, I know a lot of my colleagues think the exact same way that you mentioned there before. Oh, that's beneath me. I'm not spending that time. That's for kids. It's for whatever. Listen, man, this is the 21st century. People got to get with it. Our young generation, these are the tools that they use to communicate with each other. And this is where they get their information. And if you know that, right, you can either be one of the people that is putting good information on there, or you can be one of the people that's complaining when you're trying to understand why is it that people think that you should be able to take ivermectin or whatever. Like, you know what I mean? I'm not going to sit here and say that, oh, this medium is beneath me and I'm not putting out my stuff. I did a talk a couple years ago for the Ontario Orthopedic Academy annual meeting, and they asked me to do something there about social media. And I said, if you look at my metrics at that time, yeah, that was a couple of years ago. So if you looked at my metrics at the time, for the videos that I had put out, I can't remember how many videos I had published by that time, but the metric that I could remember in my head was, I had 2.5 million views from around the world at that time. Now I have 11 million views, right? Which some people get that a month, but I have my videos have been watched 11 million times. So here's the thing. I could be an academic surgeon. I could publish a paper and, 1,000 other orthopedic guys are going to see it. And they're going to talk about it with some of their patients, and maybe 10 patients will retain what they've said. So you take 1,000 and then you times that by 5. So that's 5,000 times that by 10, that's 50,000, right? I have done 200 videos that people have seen 11 million times from around the world. People say, oh, hi from Brazil, hi from Australia, hi from New Zealand, hi from India, hi from here, around the world, 11 million. And I'm only just a little guy, right? So when you think about the power of that and the reach of that, and if you have a message and it's worth value, if you are bringing value to people, right? Why talk to 100 orthopedic surgeons? You know what I mean? Why? Because then you do that and it's not direct to consumer. I'm talking to this guy, he's talking to that guy, and then it gets to the patient. I can just do it on YouTube and I can go directly to the patient, and it's been seen so far, as I said, 11 million times. I have several, couple 100,000 views a month. So I just think the power of it, it just makes it a no-brainer, right? And everything's going online, and this is the way people communicate. And I think you can, normally people in my generation wouldn't really gel to this, but because I had exposure with my kids, I think I feel comfortable with it. And I think, yeah, I can use that. Effective tool, man. It's very effective.
Yeah, I agree. All right, last part. I'm really excited about this one, Dr. Raynor. So I have 3 questions that I want to ask you. It's not even questions, something that we hear all the time in the office from our patients, and I just want to hear your views about it.
Sure.
So the first one is sometimes I'll have patients come in and they've been told by, I guess, magazines, news, whatever, like the information they got that from, or like other doctors or physios, and they've been told that squatting or like doing a lot of stairs or running after a certain age is bad for your knees. What would you say to that?
So I would say that's largely bullshit. So as I said to you before, we every joint in our bodies has a specified range of motion. Okay, we were given that range of motion for a reason, because we need it. The body is a very efficient machine, and if you do not use something, you lose it. And if it's not necessary, it wouldn't be given to you, right? So we have a large range of motion, and I think it's important for us for joint health and preservation. It's important for us to use the entire range of motion and try to do that relatively frequently, so that we can keep it well lubricated, and also keep the tissues compliant and keep the muscles in those ranges strong, right? So I think that it's important for us. So squatting, I think everybody should squat. I think everybody should squat every day of their life. You should always be able to get down to the floor and pick yourself up, and do so in an anatomically correct position. And so a squat is an efficient way to do that. And I think we all should be able to do that just as a skill, but more importantly, because in order for you to squat fully, you need to have good range of motion of the hips, knees, and ankles. You need to have good gluteal strength of the quadricep, particularly the VMO. You need to have good spinal erectus strength, good core strength. And so it's a full body exercise that I think everybody should do. Running, so squatting and then doing stairs. Stairs, again, it's a similar thing. Everybody should be able to do stairs both up and down. And stairs are an opportunity for us to develop. It's basically doing a single leg squat, right? It's like doing a shrimp squat or a pistol squat. That's what doing stairs is. And we need to start thinking of stairs as a training opportunity. And so rather than this impediment that we got to figure out how to traverse, it's a training opportunity. And it's not just for people who are in shape that it's a training opportunity. It's even for people who are out of shape and who are rehabbing themselves. Number one, you should be able to do the stairs. You know, even if you're elderly, you should be able to do it, because in the event that you need to egress from a building or a space, and there's no one to help you, you should be able to get down the stairs. So there is a functional requirement that is there. But more importantly, doing the stairs is an opportunity to work on the same things that you can work on with a squat. So knee, ankle, and hip mobility, the strength of the core, low back, legs. It's a great opportunity for that. And finally, running. So the one area where I wasn't quite sure about, and I still have a little bit of trepidation about that, is running, because a lot of people do it. And I had always said to people, there's not any problem with running. But I said, if you have degeneration in your knee, you may want to cut back on the amount of running that you do. And that was kind of my belief until recently, where, you know, there's more evidence that osteoarthritis is partially mechanical, but it's also partially a biological process, right? And so we still don't know yet which comes first, the chicken or the egg. Does the mechanical process elicit a biologic response, which then causes degeneration of cartilage? Or is it that there is a biologic process that occurs first, and then that starts to cause degeneration and you have a mechanical problem? Or are they just two problems that are independent, but they coincide at the same time? I don't know. But now I'm a little less hard on telling people, oh, stop running. And I say, yeah, you can run, but if you have degenerative changes in your knee, running should not be the only type of fitness that you do. And running should not be done at the expense of foregoing flexibility and strength work in your lower extremities. So I think patients should do all of those things. And I always am saying to patients, everybody should lift all the time, because I think strength and resistance training is a major component of musculoskeletal and overall health in everybody, regardless of age. So,
Excellent message. Okay, question number two. What do you think about excessive reliance or as a primary intervention in treatment of non-traumatic, non-specific low back pain when the intervention is bed rest and medications?
again, I think that's foolishness. And that goes back to what I was saying earlier, that anytime you're not doing anything, then your muscle loss is significant. I'm working on a script for a video now, and I don't have the exact numbers in my head, but the video is talking about the trip to Mars, and it's talking about the amount of muscle wasting that will occur because they're not exposed to gravity. And keep in mind, these astronauts spend 3 to 4 hours a day doing resistance training on specially designed machines that are trying to mimic gravity, but just the fact that they're not training under gravity, they lose a significant amount of their muscle mass, which sometimes can be permanent. So everybody, like when you are having bed rest from low back pain or for low back pain, there is going to be a certain amount of muscle strength that you have lost, and the muscles will become less compliant simply because you're not moving them. And so you have to recover that. You got to fix that. You have to restore that somehow. And bed rest and medication are not key. So if something is very acute and it is very severe, that may be required for a extremely short period of time. But the goal should be for everybody to start moving as quickly as they can. And then once they can start moving, start to progress and scale the exercise so that you can go from simply moving to then flexibility work and strengthening work, and then a return to activity. I had last summer, I had an episode, like every adult is going to have at least one episode of back pain in their life. And, I think I'm in reasonable shape, but I don't think I'm in great shape, but I think I'm in reasonable shape. Anyway, I'm always doing weird things. And so, you mentioned the mace, and before I had the mace, I had the maces, I should say. I was trying to figure out a way how to do some mace work. So I had this thing from our gym, which was called the bell hammer, which was just basically, it's a handle that you can put various dumbbells on it. And you're supposed to be using it as a sledgehammer to hit tires, but it's weighted. And so you can change the dumbbell to put different weights on it. So I don't know what I had on there. I have a 10-pound, or maybe it's a 15-pound. I don't know. But I hadn't done rotational work for a while, and I had not done anything with a mace before. And I was just experimenting because sometimes I'm just trying to figure shit out. And so I started doing some swings, and I was like, oh, I get the handle of this. I like it. And I'm just playing because I don't know anything about maces yet. I was just playing. Anyway, I did a bunch of stuff for about half an hour. And so it's a new movement. My back is naive to that way of moving. And then immediately after that, it was a hot day. Because it was hot, I jumped into the pool. And I was, and then, I'm not a strong swimmer. And so I was just, I was all warmed up from the mace work. I thought I'm going to try to work on my treading water. I'm going to see how long I can tread water for. So I did that. Combination of those two things, my back I got out of the pool, not because my back hurt. After I spent time treading water, I got out of the pool because I did that for about 15 minutes, got out of the pool. And then I sort of felt a little bit funny in my back. And I was like, whoa. So then I started to walk towards the house. And from the pool to the back of the house is like 100 feet. By the time I got to the back door, I was on my knees. And then I barely crawled in the back door. And then by that time, my back was entirely seized. And I don't take pain medication for my back. I don't do any of that. But on that day, I could see what people sometimes, what could drive them to, because I did take a Robaxacet. I literally was curled up in a ball on the floor. The initial spasm in my back took about 2 to 3 hours to stop. And eventually, I started to do some McKenzie movements, after about 3 or 4 hours where I was just like huddled up in a ball. I was able to start moving and then get moving. And then by the evening, I was okay. I had back pain from that for a couple of weeks, and it just gradually got less. Never was enough to stop me from doing anything, but it was sore for a bit after that. And, that just came from me doing a new movement, too much load too quickly. And my body was naive to that. And so, I can understand where people are coming from, but having said that, I tried as quickly as possible. Like I was only laying down for 3 hours. The rest of the time, like I was trying as quickly as I could. As soon as I could, the pain would settle a little bit. Okay, now start moving. Boom, curl, cat, cow. Oh, yeah. And so long and short, bed rest, medication. If you absolutely have to, in the immediate short-term period, go ahead. But your goal should be to move as quickly as possible.
Excellent. All right, final question. I know you've already touched on this, Dr. Raynor, but what do you think about when we hear a lot of patients say that they have osteoarthritis and this is a life sentence and they have to live their rest of their life in misery?
Yeah, so I don't think that's the case. So I'll tell you now, I have osteoarthritis in my knees, and that's a function of me having 5 knee surgeries, right? 3 on one side, 2 on the other. And having partial meniscectomies on both knees. So I have arthritis. If you look at the x-rays, now my arthritis is not necessarily end stage, because yes, arthritis is a degenerative process. But it's not necessarily a life sentence, and there are things that you can do to sort of slow the progression of it. I don't think there's anything that we can do that will reverse it, and that's not exercise, not stem cells, not PRP. There's nothing that's going to. We've not figured that out yet, but there are things that we can do to slow it down. So yes, you have it, but that doesn't mean that you can't do anything. And I think it's still important for people to work on strength, flexibility, and mobility work, because there are studies that show that if you take people who have arthritis and you split them into 2 groups, and you have the people who do no exercise, and then you compare them against people who also have osteoarthritis but do strength and flexibility and conditioning training, the studies show that the people who do strength training and flexibility work and conditioning all have better ranges of motion, less pain, better function than do their similarly paired people who also have arthritis but that don't do those things. So even if you have arthritis, I think it's important to do those things, because you're going to have less pain, you're going to have better function. But in addition to that, when it comes to the point where you have to say, okay, enough is enough, I need to have a knee replacement, one of the greatest indicators of post-operative function of a knee replacement is your preoperative function, right? And so if you haven't done anything because, oh, I have osteoarthritis, it's a death sentence, whatever, and then you come to us and your knee is stiff and you have no muscle mass around it, well, once I put in this joint, your knee is still going to be stiff. It's going to take a crap ton of work to address that stiffness and improve upon that, right? So if you want to have a good result afterwards, you want to try to maximize and optimize your function beforehand. So it's, yeah, sitting around thinking of osteoarthritis as a death sentence, I think is or prison sentence is not the right thing. I think the better way to look at osteoarthritis is that it's a chronic condition, right? But that you can minimize the effects of, and you can optimize your function despite having had this chronic condition. So I think that's the way that people should look at it. And I encourage everybody, all of my patients to be as active as they can, even if they have osteoarthritis. How can we maximize your activity and get you as strong as possible, as mobile as possible, and as flexible as possible.
Excellent message from, I'd say, the horse's mouth, the surgeon himself. So I would say this has indeed been a great pleasure, a great conversation for me. I've learned a ton. I hope people can listen to this conversation, go to your page, and see all the other work that you've been putting out. Do you mind sharing with us all the social media platforms that you're on?
Certainly. First, and thank you for giving me the opportunity to do that. And I've had a great time with this conversation, and I hope that it's been educational for you and for your viewers and listeners. Yeah, people can find me on Instagram at Stable Knees. So that's with a Z, all one word. I'm also on Twitter, same handle there, Stable Knees. I'm on TikTok. Somebody stole Stable Knees, so I am Dr. Raynor, CHRISRAYNOR. And then on YouTube, if you just look up Dr. Chris Raynor, I think my thing is Chris Raynor or Dr. Chris Raynor MD. But if you just look up Dr. Chris Raynor on YouTube, then you'll find me.
Excellent. Yeah.
Oh, and you can look up, and you can find Human 2.0 also on all of those platforms as well.
Oh, that's right. You're putting a lot of workouts on there. So I did notice that. Yeah. That's amazing. Absolute pleasure talking to you again. And hopefully I'm looking forward to further interactions with you, Dr. Raynor.
No problem. Thank you very much for inviting me and giving me the opportunity to talk to you and to your listeners. And yeah, I hope this was of value.
Excellent. Have a great weekend, doctor. Thank you so much.
You too.
Bye-bye.